Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Here's Eddie Frederick.
So glad you can join us. Trinidad and Tobago is under day 3 of a state of emergency in its attempt to curb the spread of COVID-19. This story takes the lead in our 1114th edition of Caribbean Perspective for Tuesday, 18th May 2021. Details after this break.
Hubbard's big promotion is back. Live free for 1 year. Spend $50 or more in any Hubbard's department and receive a chance to win big prizes every month. Property or vehicle insurance for 1 year. Free internet, cable and data for 1 year. Free fuel for 1 year. Free cooking gas for 1 year. Free electricity for 1 year. Free drinks for 1 year. Extra cash account and the big free groceries for 1 year. Promotion runs from April 1st to September 30th, 2021. Live free for 1 year with Hubbard's in association with Solgas, Flow, Grenadian General Insurance, Carib Brewery, Coca-Cola, Grenada Bottling Company, Grenlec, Communal Cooperative Credit Union, Dutch Lady Milk, Promo, Danny and Supreme. Terms and conditions apply.
Welcome back. The numbers of COVID-19 positive cases in Trinidad and Tobago have been increasing at an alarming rate, prompting the government there to turn to a state of emergency to help bring down the numbers and avert a humanitarian crisis. Terry Ann Brown Campbell of TTT News reports.
A state of emergency has been implemented to control the wildfire spread of COVID-19 cases with its spiraling death toll that is sweeping across the country. Prime Minister Dr. Keith Rowley made the announcement at the Diplomatic Center on Saturday.
From midnight tonight, Trinidad and Tobago will be under a state of emergency involving a curfew that from then onwards would be 9 p.m. to 5 a.m.
Prime Minister Dr. Rowley described the dire circumstances that led to the decision. He further noted the parallel healthcare system will soon be unable to keep up with the increasing cases.
We are now dealing with 21 deaths in 1 day, and if you bring that down to per hour, it's almost 1 person dying every hour. That is a frightening situation. And of course, if that is allowed to multiply, very soon we would be happy when it's only 21, because it could go to a number where 21 is a great improvement.
The Prime Minister disclosed the sectors and personnel who would be able to operate outside of the SOE.
National security in all its forms, of course the health department in all its forms, the Ministry of Energy's work, the energy sector will remain under. The utilities will remain exempted. Ports and airports will remain exempted. All tentacles of the food supply chain.
He said pharmacies, public transportation and elements of the public sector would need to be exempted so that workers could continue to receive their salaries. Details of the state of emergency will be fleshed out by the Attorney General. Terry Ann Brown Campbell, TTT News.
And shortly before the Prime Minister's announcement of a state of emergency, the Ministry of Health's Principal Medical Officer, Dr. Miriam Abdul-Richards, explained that this country's parallel healthcare system is facing troubled times. She said the healthcare system was at a touch-and-go stage with a 73% occupancy at hospitals in Trinidad.
Please do not be comforted by the fact that we have 27% more occupancy level. As I've been indicating, and as you all know, a bed is no longer a bed. And even though there may be physical beds, the resources that are required to give you the best level of care may not and are not available.
Dr. Abdul-Richards said all intensive care unit beds were occupied, with the HDU now at 95% occupancy.
The ICU level, all beds are filled, and we are in the situation of having to add beds, convert beds, add ventilators on a daily basis. The ward level beds are currently at 66%, and our new step-down facilities are at 57% today.
The Prime Minister, meanwhile, said his decision to call a state of emergency is guided by the medical data, which now suggests that the nation's parallel healthcare sector is reaching full capacity. So how long will it last? Joel Brown of TV6 News has some details.
I am still hearing the stories on the deathbeds of people who are in parties. We've heard about curfew parties, we've been here before.
The plea to the population from the Thoracic Medical Director at the Cora Hospital, Dr. Michelle Trotman, after Prime Minister Dr. Keith Rowley announced a state of emergency to deal with a surge in COVID-19 cases and an increasing COVID death toll in Trinidad and Tobago.
I'm sorry that it has come to coffins and the faces of dead people for us to realize that we are in and always has been in a very difficult place.
TV6 News sought clarification from the Prime Minister as to how long the state of emergency will last, given that the present lockdown of much of the economy, which began on April 29th, is due to end on May 23rd. Will there be a state of emergency up to the 23rd or beyond?
The state of emergency that we put in place now will remain in place until it is either expired or discontinued. We move into a state of emergency, but not until next week or week after. We are in a state of emergency, and I will hold it that way for the time being. The 23rd is where we had looked at another date cast in stone.
According to the Constitution, the President may from time to time make a proclamation declaring that a state of public emergency exists that must satisfy specific criteria, which includes an outbreak of pestilence or infectious disease.
The state of emergency allows us under law to be there for 90 days. So at least 90 days in the first instance. It may not be 90 days, maybe 30, maybe 60, but it is in place now to allow us to have a bit more rollback.
The last time Trinidad and Tobago was under a state of emergency was in 2011 during the People's Partnership Administration to deal with escalating crime in Trinidad and Tobago. On that occasion, the state had to pay claimants who filed civil suits over wrongful detention.
The answer to that is that none of us in this country have ever been in a state of emergency during a pandemic. Take that. Use that as your guide.
As for the public debate over whether the police can intervene if there are large gatherings in private homes under the public health regulations,
all of that has been solved by me using the state of emergency, which is properly ensconced in the laws of Trinidad and Tobago. Because you see, I didn't want to use the provision that is existing now in the public health ordinance, because not very many people give the respect to the ordinance that they give to the state of emergency.
The Prime Minister referred to two calypsos as he called on the population to help end the COVID surge, one of which contained a word that has become part of a popular phrase at this time.
And Devon Seals has come to my aid to appeal to you. And he say, in his calypso, he say, don't jackass the thing.
Joel Brown, TV6 News.
You're listening to Caribbean Perspective with Eddie Frederick.
Still on Trinidad and Tobago, Dominic Calipasad of TV6 News reports that Prime Minister Dr. Keith Rowley says the government is taking all the necessary steps to prevent the virus from spreading more than it already has. He's also pleading with all of Trinidad and Tobago to cooperate with the new rules given, and he thanks the business community for their support.
Prime Minister Rowley says the government is taking all the necessary steps to prevent the virus from spreading more than it already has. He's pleading with all of us to cooperate with the rules given and thanks the business community for their support.
I want to thank the leadership of the business community for taking the lead in coming out and supporting these initiatives, not supporting the government, because this is not about the government. Because no government is on any bed in any hospital or in any morgue. The government is manager of the situation with the responsibility for taking decisions to give us the best chance to survive all the circumstances as they come at us. So I want to thank the leadership of the business community, because had they not done so, the conversation after this press conference would have been a continuation of don't do this, don't do that, because I'm going to lose this, I'm going to lose that. Right now, the singular conversation is whether or not you're going to lose your life, or somebody you think well of, family or not, could lose his or her life.
In other news, an earthquake with a magnitude of 4.3 rocked 3 islands in the Eastern Caribbean early Sunday. The Seismic Research Center of the University of the West Indies, UWI, said the quake occurred just after 8 a.m. and was felt 126 kilometers north of St. John's, Antigua and Barbuda, 131 kilometers northeast of Bastia in Kitts Nevis, and 226 kilometers north-northwest of Pointe-à-Pitre, Guadeloupe. The quake had a focal depth of 10 kilometers. There were no reports of damage or injuries. Little Island, Big Barbados is the new brand unveiled by the island's tourism authorities at a recent virtual launch. More in this Barbados Today news item.
Tourism Minister Lisa Cummins declared that Barbados is open for business and safety is a top priority.
So this destination relaunch is what we're focusing here today. Getting Brand Barbados back out there is what we're focusing on today. Helping our people to inspire pride in who we are and to share that pride with global audiences. We have to encourage people who haven't traveled in 18 months to choose Barbados over some other destinations that perhaps are so encouraged by the fact that there are vaccinations taking place globally that they're removing nearly all public health screening and testing requirements for entry into their country. That is not Barbados's way. Safe Barbados is what we're prioritizing and what we're offering to our partners. We're offering new life into the arteries of Barbados for our visitors and for our locals.
Today's launch comes on the heels of news that the Centers for Disease Control and Prevention has moved Barbados one notch down from its Level 4 warning for travel to Level 3. The Tourism Minister says it's good news.
Certainly, yesterday's advice from the CDC out of the United States that Barbados has moved from Level 4 to Level 3 is a positive signal. And it is a nod to the confidence from the United States, one of our major source markets, that we depend on each other in more ways than ever.
Did you know that your friends and family can now shop at the Food Fair from anywhere in the world, and you can receive here in Grenada? The Food Fair and GrenadaMarket.com now make it possible through secure online shopping and personalized customer service. Simply send your loved ones a list of your preferred items or let them fill an online basket, and the items will be available for pickup or delivery. Visit GrenadaMarket.com or thefoodfair.gd today for more details. The new norm. Spread the news.
I am Eddie Frederick. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.